When people with dementia participate in a reablement program, it is important that individualized, meaningful goals are set in collaboration with the person with dementia, their allied health team, and where appropriate, their family. This practical guide was developed to support allied health practitioners with setting meaningful functional goals with their clients with dementia to evaluate reablement program outcomes. The guide presents 3 concepts into a single framework to guide the use of goal attainment scaling to evaluate meaningful functional outcomes for people with dementia who participate in a reablement program. The guide contains 3 reablement goal lists that are designed to support discussions for clients to identify personally meaningful and desired goals for either occupational therapy, falls prevention, or mobility and physical function. Through this process, the person and/or their family should be prompted to consider a range of potential goals that they identify as personally meaningful or important. Practitioners should consider applying the tenets of supported decision-making to support clients in identifying their goals. For example, the occupational therapy goal list contains goals centered around leisure, thinking, planning, and coping, and everyday activities. If an occupational therapist was working with a client with dementia, they could show this list to the client and, where appropriate, their family, to provide some examples of what sort of goals could be addressed through a reablement program. When setting goals, a range of factors need to be considered for every client to ensure realistic goals are established. For example, a person's goal might be to regain their ability to manage the garden. This will depend on their personal characteristics or intrinsic capacity, like their physical and cognitive health and what is possible to achieve through therapy, as well as what social support they have and the environmental context of their backyard garden. Once the goal has been identified in partnership with the client in Step 1, the practitioner needs to define it in Step 2. The goal should be defined to be a SMART goal: specific, measurable, attainable, relevant, and time-bound. The guide contains a SMART framework that provides practitioners with a range of examples to help in defining the goal explicitly using 2 broad domains: support needed and quantifiers. The aim of this framework is to help practitioners to quickly and consistently set SMART goals and consider varying attainment levels. Once the goal has been identified in Step 1 and the parameters have been defined smartly in Step 2, it is time to score. The goal attainment scaling light scoring system may be applied at the beginning and again at the end of the reablement program to determine the client's level of goal attainment. The guide presents a practical tool for using the goal attainment scaling light approach. This tool allows practitioners to score goal attainment scaling using a verbal description of functioning with no need to apply the numerical scoring system. This case study illustrates goal setting and evaluation of meaningful functional outcomes for a person with dementia who engages in a reablement program. Mr. Wong is 72 years old and living with mild dementia. He lives with his wife, who is also in her 70s. Mr. Wong used to work as a market gardener and is keen to work in his vegetable garden. He particularly enjoys watering the garden and pulling out weeds. Sometimes Mr. Wong forgets to pack away items he's used, such as the hose. Recently, he tripped on the hose and fell to the ground. He was not able to get up and his wife called an ambulance for assistance. Now, Mrs. Wong provides standby assistance whenever they're in the garden. Mrs. Wong wants to support her husband in continuing with gardening as she knows how important it is to him, but she's worried about him falling, so she arranged for him to receive a reablement or rehabilitation program through their local community aged care provider. Mr. Wong identifies his goal as, "I want to work in my vegetable garden," and Mrs. Wong articulates her goal as, "I know he loves being out in that garden, but I am worried about him falling, and when he does, I am not strong enough to help him up. I want him to be safe." When the allied health team assess Mr. Wong, including his current function towards his goal, his environment and situation, his SMART goal is set to be: identify and trial the most appropriate gardening aids for Mr. Wong, so that by the end of the reablement program, he will be able to effectively use the aids, with verbal prompting from his wife, in the garden to reduce his chance of falling while watering the plants and doing the weeding. The team then used goal attainment scaling light to score Mr. Wong's current level of functioning towards his goal. The reablement program involves a multidisciplinary team working together to help Mr. Wong achieve his goal. The occupational therapist assessed Mr. Wong's outdoor mobility, his ability to use different aids, and helped to identify the most appropriate garden aids to support Mr. Wong's continued participation in gardening, such as a raised garden bed and a retractable hose, to reduce the chance of tripping over it. The occupational therapist also provided support in strategies for using the new aids and worked with Mrs. Wong to develop appropriate communication and activity support strategies. The physiotherapist assessed Mr. Wong's balance and strength and provided an appropriate mobility aid to use when outside in the garden. The physiotherapist also helped Mr. and Mrs. Wong to learn strategies for getting up if he were to fall. Finally, the exercise physiologist provided specific exercises to support Mr. Wong's engagement in his preferred activity of gardening, for example to bend over in order to weed, or to increase his chances of getting up if he were to have a fall. The exercise physiologist planned an exercise program involving lower limb exercises, including balance and strength to support bending, core-related exercises to support leaning forwards in the garden, and arm strength to support the use of selected aids. At the end of the program, Mr. Wong's allied health team again used goal attainment scaling light to score his current level of functioning towards his goal. Through the multidisciplinary Reablement program, Mr. Wong was able to achieve the goal that was set, as expected. To access this goal-setting guide resource, or any of the other evidence-informed dementia Reablement resources, please do so via the below link.